Assalamualaikum. My name is Rikza and I am a student of BS Clinical Psychology. Today the topic of my lecture video is traumatic brain injury. Traumatic brain injury is the leading cause of death and disability in adults and children. Every year approximately 52,000 deaths occurs from traumatic brain injury. Now move towards the definition. A form of acquired brain injury which occurs when a sudden trauma causes damage to the brain. ये किसी भी ट्रॉमा की वजह से जो भी ब्रेन पर इंजरी होती है इसको ट्रॉमेटिक ब्रेन इंजरी कहते हैं. ट्रॉमेटिक ब्रेन इंजरी is usually caused by a blow or other traumatic injury to the head or body. The degree of damage can depend on several factors, including the nature of the injury and the force of impact. Now move towards the causes. Common event causing traumatic brain injury include the following. The first cause includes the falls from bed or ladder downstairs or in the bathroom, and other falls are the common cause of traumatic brain injury. Now move towards the second cause, that is the vehicle related collisions, that includes cars, motorcycles and bicycles accidents. Third cause of traumatic brain injury is violence. Violence includes gunshot wounds, domestic violence, child abuse and other assaults are common causes. Shaken baby syndrome is a traumatic brain injury in infants caused by violent shaking. Now move towards the next cause, that is sports injuries. Traumatic brain injuries may be caused by injuries from a number of sports including football, boxing, baseball, skateboarding, hockey, etc. These are common in youth. Now move towards the classification of traumatic brain injury. The classification of traumatic brain injury includes the open brain injury and the closed brain injury. Closed brain injury, without the skull being broken or penetrated and the brain has not been exposed. Closed brain injuries occurs when there is a non-penetrating injury to the brain with no break in the skull. A closed brain injury is caused by a rapid forward or backward movement and shaking of the brain inside the bony skull that results in tearing of brain tissue and blood vessels. Closed brain injuries are usually caused by a car accident and falls. Shaking a baby can also result in this type of injury called shaken baby syndrome. Open brain injury. Penetrating or open head injuries occur when there is a break in the skull, such as when a bullet pierces the brain. It is typically marked by focal damage that occurs along the route the object has traveled in the brain, that includes fractured, perforated skull and the damage to the brain tissues. And this is all about open brain injury. नेक्स्ट जो है ये एक पिक्चर शो गई है जिसमें डायग्रामेटिकली ओपन ब्रेन इंजरी और क्लोज ब्रेन इंजरी को एक्सप्लेन किया गया है. Now move towards the pathophysiology. Pathophysiology includes the primary injury and the secondary injury. Primary injury is the injury which is directly caused by mechanical forces during the initial insult, and the second injury is the injury which refers to the further tissue and cellular damages following primary insult. It may be delayed from the moment of impact, and it may be superimposed injury on a brain already affected by a mechanical injury. Now move towards the primary injury. Primary brain injury refers to the sudden and profound injury to the brain that is considered to be more or less complete at the time of impact. This occurs at the time of the car accident, gunshot wound or fall. Next is the secondary injury. Secondary brain injury refers to the changes that evolve over a period of time from hours to days after the primary brain injury. It includes an entire cascade of cellular, chemical, tissue or blood vessel changes in the brain that contribute to the further destruction of brain tissue. Signs and symptoms. The signs and symptoms of mild traumatic brain injury includes loss of consciousness for a few seconds to a few minutes, memory or concentration problems, headache, dizziness or loss of balance, difficulty in sleeping. The symptoms and signs of moderate to severe traumatic brain injuries include loss of consciousness from several minutes to hours, slurred speech, inability to awaken from sleep, weakness or numbness in fingers and toes, loss of coordination, persistent headache or headache diversions. The children's symptoms include change in eating or nursing habits, persistent crying and inability to be consoled, change in ability to pay attention, change in sleep habits, sad or depressed mood. Doctor's treatment operative. Enclosed head injury surgery does not correct the problem. A bolt or ICP monitoring device may be placed in the skull to monitor pressure in the brain cavity. If there was a bleeding in the skull cavity, this may surgically removed or drained. An open head injury confronts doctors with the same issues as a closed head injury. However, in addition, skull fractures may need to be repaired and damaged tissues removed. Thank you so much.